Intraoperative VHN case. This is the OneTrial ipsilateral workflow. Once the case is created, click OneTrial workflow to start, or you can add images prior to starting the workflow depending on surgeon preference. In this example, we'll add the preoperative AP hip. This is prior to the neck cut, and we're going to select from our available images. Ensure that the greater trochanter is visible. The pubic symphysis and acetabulum should be centered on the screen. Be sure to have some space above the acetabulum to mark the pelvic reference line. Also make sure that some of the femur canal is visible. The first step is to mark the greater trochanter. This needs to be the highest point of the greater trochanter. Think of a golf ball on a tee. The highest point should touch the bottom of the ball marker. Now, establish the center of rotation preoperative. Draw a circle around the femoral head. The plus sign is going to establish our preoperative center of rotation. If you have a collapsed or flat femoral head, recreate where the femoral head should be based on where the center of rotation is. Align the femoral access tool down the canal. Line up the medial calcar, ensuring that the dotted line is going neutrally down the canal. You can resize the femoral access tool here. Dragging the image up itself and looking at the distal end of the femoral axis tool is a good way to ensure that you're getting this straight down the canal. The pelvic reference line is going to be the point that is scaling the image in real time. Ensure you drag it from the inferior edge of the pubic symphysis and find a reproducible point above the acetabulum. This can be an osteophyte. It can be a dark mark. Make sure to pick something that can be recreated. This is going to allow real-time scaling during the case. When marking the teardrop, it helps to find a well-defined hook or loop if possible. If there's no visible teardrop, use the superior edge of the obturator. Now that preoperative points have been established, set up the cuff analysis. Make sure you have the AP pelvis. The surgeon can have this taken at the beginning of the case or taken when they are reaming. Make sure the teardrops and obturators are symmetrical. Now, establish the neutral axis, which is marked by the inferior edges of both teardrops. The software will automatically populate the teardrop brim line based on the neutral access point that you have set up. Align the tool with the pelvic brim line. The line length does not matter as long as the angle is hitting the edge of the pelvic brim. Now, when the surgeon brings the cup over, make sure that it is centered on the screen like this example shows. If we are getting a fuller pelvis, or we're showing the contralateral side, it will introduce some parallax into the image. Ensure that the image is centered on the screen to combat this. Now recreate the teardrop brim line. Then dial in on the inclination and T-version based on the specific cut position. You can set these to the surgeon's desired inclination and T-version and overlay it to their current cut position. Drag the green marker over the top until the surgeon is happy with the position. Now that we know our cup size, choose the pinnacle cup and set the size that's implanted. Is working on the stem and the implant sizes are determined, enter the sizes into the system. For this case, it knows that there is a CRI colored stem and the sizes can be selected. Need to go back and change something? Click the back button, complete the selection, then take the same image for the intraoperative AP hip. Try to replicate and be consistent with all points and find the highest point of the greater trocar by zooming in. Next, re-establish the center of rotation and scale the image. This is an important step because it is giving the software a known size. Make sure to mark the shoulder of the implant, as this is going to help determine valgus and varus on the implant. Keep half in, half out in mind to remain consistent from trailing to the final stem. The goal is to recreate the pelvic reference line by dragging the line that needs to be remarked at the inferior edge of the pubic symphysis back to the previously established reproducible point. Now, remark the teardrop. Next, rotate the template to match the current cut position. The goal is to realign the femoral template down the canal. Aim to create a neutral position down the stem or down the canal. Try not to chase a valgus or varus stem, but recreate the neutral axis down the actual femoral canal. Next, align the femurs. You can change the transparency to get a better idea of position. Now that we have our surgeon checkpoint, bring your surgeon over to confirm at this time. If agreed, click Next. This establishes the OneTrial analysis. The current position with these implants is 2 millimeters of added leg length. You've reduced the total offset by 1 millimeter. If your surgeon prefers femoral offset, you can change the chart to show the femoral offset, which is a +2 on the femoral side. This OneTrial analysis will provide the different head sizes, leading to different results. Based on the goals for this patient, if you wanted to lengthen the patient some more, for example, 5 millimeters, a +5 head will get you to a +5 on leg length and +5 on femoral offset. Both tabs show the same data for both femoral and total offset. Near the image, you can change the overlays based on surgeon preference. From the trial, if you want to analyze a new image, you can click Analyze New Image and put in your final stem. Now, recreate the steps again, trying to be as consistent as possible.